All right, today we're going to peek behind the curtain of the operating room, metaphorically, of course, to really break down what it means to be a modern surgical master. So, what really makes someone the best of the best in the 21st century? We're going to figure that out by taking a look at the incredible career of Dr. Pinak Dasgupta. And really, it's a question that's so much bigger than just having a steady hand, right? Is it just about how many years you've been doing this? Or is it about having all the latest, greatest tech at your fingertips? Or maybe is it something else entirely? A mix of all of it? Well, that's exactly what we're here to unpack. So here's how we're going to tackle this. We're going to look at 6 key parts to build the whole picture. We'll start with the surgeon's core profile, then dig into the foundation of their expertise, talk about the robotic revolution, which is super cool. Then we'll do a deep dive into hernia repair specifically. After that, we'll look at their legacy outside the OR. And finally, and maybe most importantly, we'll hear about the patient experience. Okay, so let's get right into it. The foundation of expertise. Basically, what are the core credentials? The numbers and the unique skills that really set an elite surgeon apart from everyone else. First up, you've got time. We're talking over 21 years of experience. And look, that is not just some number on a resume. That's thousands and thousands of hours in the operating room. It's seen countless unique situations with patients. It's the kind of gut instinct and seasoned judgment you just can't get from a book. No way. And all that time naturally leads to just sheer volume. Think about this, over 5,000 successful hernia surgeries. When you've done one specific procedure that many times, you've pretty much seen it all. Every little variation, every possible complication, and your technique, it becomes incredibly refined, almost second nature. And then you've got something you can't really teach, a unique, almost built-in advantage, being ambidextrous. In the super intricate world of minimally invasive surgery, being able to operate just as well with your left hand as your right, that's a huge deal. It gives you more flexibility, way better angles to work with, and just makes you more efficient when things get complicated. Okay, so you've got the deep experience, you've got the natural skill. But let's be real. In today's world, that's only half the story. The other half? It's all about technology. So let's dive into the robotic revolution and see how it's totally changing the game inside the operating room. So what is robotic surgery anyway? Well, to put it simply, instead of the surgeon standing over you with a scalpel, they're actually sitting at this high-tech console, controlling these incredibly precise robotic arms. It basically lets them perform with a level of control and precision that's, well, beyond what a human hand can do on its own. And this right here, this shows you exactly what that means for the patient. With traditional open surgery, you're often looking at bigger incisions and, honestly, a tougher, more painful recovery. But the robotic way, we're talking smaller incisions, less pain, less blood loss, and you get back to your life way, way faster. Plus, the cosmetic results are a lot better too. So how does the tech actually do all this? Well, it's almost like it gives the surgeons superpowers. They're seeing everything in crystal clear, high-def 3D. The robotic wrists can bend and twist in ways a human wrist just can't. And get this, the system completely cancels out any tiny natural hand tremor. It's the perfect team-up of human expertise and robotic precision. All right, so we've seen how a modern expert blends years of experience with amazing technology. But there's one more piece to this puzzle. Focus. Real mastery, true expertise comes from specializing, going deep into one area. And for Dr. Dasgupta, that focus is all about hernia repair. And we're talking really deep specialization here. This isn't just about handling your standard run-of-the-mill hernias. Look at this list. The expertise covers the whole spectrum, from the common stuff to the incredibly complex cases, even hernias that have come back after a previous surgery didn't work. Being able to handle that range, that's the mark of a true specialist. A real specialist doesn't just have one trick up their sleeve. They've got a whole toolkit. They can pull out whatever approach is best, from the traditional open surgery to minimally invasive laparoscopy to the most advanced robotic techniques. They can even do these super specialized abdominal wall reconstructions. It's all about tailoring the perfect procedure to the patient. But being a world-class surgeon isn't just about what you do inside the OR, right? A true leader's impact goes way beyond that. It's measured by how they contribute to the entire medical field. So let's take a look at that legacy of excellence. You know you're doing something right when your own peers recognize you for it. I mean, being named the best robotic surgeon from South India, that's a huge deal. But winning it 2 years in a row, that shows this isn't a fluke. That's the sustained leadership and proof that you're consistently at the absolute top of your game. And a massive part of being a leader is passing on what you know. It's all about mentorship. Think about it. When you train over 500 other surgeons from all over the globe, your impact it explodes. You're not just helping your own patients anymore. You're raising the standard of care for patients everywhere. That's how you build a real, lasting legacy. Leaders also don't just follow the rules. They help write them. They push the whole field forward. And they do that by publishing their research in top journals, pioneering brand new surgical techniques, and sharing their work at conferences. It's about not just practicing medicine, but actively advancing it for everyone. Okay, so we've looked at the numbers, the amazing tech, all the awards, but at the end of the day, all of that has to lead to one thing: the patient. What does all this expertise actually mean for the person who needs the surgery? That right there is the ultimate test. It's the real measure of success. And this quote right here, it perfectly captures the benefit of that robotic surgery we were talking about. I mean, just 1 week after surgery, and this person is back to their normal activities. That kind of quick turnaround isn't magic. It's a direct result of using these advanced, minimally invasive techniques. And this next one, this one gets at something just as important as the physical recovery. It's about trust. When you or a loved one is facing a really complicated surgery, of course you want skill, but you also need to feel that you're in the best possible hands. And that's where all that technical skill becomes something more. It becomes true, compassionate care that a patient can feel. So after all that, what's the takeaway? We've seen this incredible mix of deep, hands-on experience, total mastery of cutting-edge technology, a laser focus on one specialty, and a real commitment to patients and the medical community. So the final question is this: is this combination, this blend of human skill and technological precision, the new gold standard for surgical excellence? That's definitely something to think about.